Hey, you also just wanted to get this information to you about a blood pressure medication you might be familiar with. Now, this is about amlodipine, and basically, I want to give you some information on like how it works with your body and the side effects and why those side effects are there, and then some other options for those of you that want to find a way to actually get to the solution of your issue and hopefully be able to come off this medication. But regardless if it's for you or somebody else, you probably know someone that's on a blood pressure medication. So the amlodipine, it's a calcium channel blocker. So other medications you might have heard about or Procardia, Plendil, there's a Cardine, Dynacirc, Solvar. Now, the way that it does this, and this is really important because when you get recommended, when anything is recommended to you, but now we're talking about prescription medications, make sure that you ask what the mechanism of action is. The mechanism of action would explain how it assists your blood pressure, because like I said, there's different types of blood pressure medications and they affect your body and assist with lowering your blood pressure, and it goes about doing that in different ways. And the thing is that our blood pressure is increased for many reasons, and we're going to go into some things that are really important. But whenever you're recommended something, make sure that you ask, well, what is the mechanism of action? How does this drug accomplish what you're saying it's going to do? Okay, so always ask that. And so what it does is, see, because the calcium, it affects the contraction of our muscles. Calcium is not just for the bones as we might think, but it's for other aspects of our body, and it also affects our muscle contraction. So, and this will make a lot of sense when we go into the side effects as to why some of the side effects are there. And so it'll help to loosen them up so that the blood flows a lot easier. Okay, now here's some of the issues here. Okay, so it doesn't just relax blood vessels, but it causes the system-wide imbalances. And what that is, okay, if your body needs a certain amount of calcium in order to be able to perform this action, you're changing that or focusing on the calcium only to get that response. The issue is that we still need the calcium for other things within our body. And so this is where the side effects come into play and really harm us when we're looking at the long-term effects, okay? One of the side effects that you might have heard about is the swelling in the feet and the ankles, which is called peripheral edema. Now, what happens to the arteries will relax, but the veins don't. So the fluid leaks into the tissue, causing the swelling. And you know, this is the reason why it's so important to not just take something and say, oh, this is for my issue. You see, as we go through a number of these, that you'll see that it's not addressing the root issue. And this is really what I want to reinforce. Another one of the side effects is dizziness and lightheadedness. The blood pressure drops too quickly, reducing the blood flow to the brain. Okay, so this could happen as well. Another one of the symptoms is fatigue. And the reason why this can take place is because you're getting less oxygen and nutrients to reach your muscles and your brain. Remember, the blood that's flowing, it's for every aspect of our body, okay? And so if we're doing something just to get a reading or a number, then there's nothing that takes place in the body that's isolated, okay? And so this is another one of the side effects, flushing, because more blood flow is near the skin, making you feel warm and red. Another one is heart palpitations. This is when your body will compensate for the low blood pressure by increasing the heart rate. This is not good. Another one is headache. So that's when the blood vessel expansion increases pressure in the head. So all of these responses are taking place. And this is taking place because of the mechanism of action, the means by which they're accomplishing this goal. You see, our body is connected in every aspect. You do something to one part of the body. If something happens in the mouth, it affects the rest of the body. All of these things are connected. There's nothing isolated. So you can't say, I'm going to go do this just so I can get the response in this area and think that it's not going to have an impact on another area. Okay? So we have the dizziness, the lightheadedness, the fatigue, the heart palpitations, the headaches, the gum overgrowth. And now, see, this is important. I wanted to not just go over the symptoms, but I wanted you to understand why you have these symptoms. Sometimes we'll look at a label and we'll see the symptoms. I have this, I have this one, or I don't have this one. but we don't understand why you have the symptoms. If you take a drug and it says gives you upset stomach or you experience upset stomach, the question is, why are you experiencing that in your stomach? And that's going to help you to get to the root of the issue and to be able to determine, do I want to take this drug or do I really want to get to the root? And hopefully you're one of the ones that want to get to the root cause or the root issue. Another one is nausea and digestive issues. And this is because, guess what? We have muscles in our stomach to help churn and process the food. We need those contractions, peristalsis that takes place in our stomach to help to process the food. Well, if you're blocking this just to get a response somewhere else, well, then what's happening to your digestive system? And we know that if our nutrients aren't being absorbed, then guess what? Our body can't heal and recover, because those are the building blocks for us to be able to perform the actions. Nutrients help our body to perform the action of regeneration and of healing and recovery. And so if these nutrients are being blocked, then guess what? Our body is not getting better. And this is one of the reasons why you would know someone who's on a drug for an extended period of time, and then they need another drug for another side effect, then another drug for another side effect. Why? Because you didn't get the root cause. If you come in your house and the floor is covered with water because you left the faucet on, and you say, let's grab some towels and let's go and clean this water up, but you never go to the faucet and turn the water off. So you want to turn the water off. And so this is why it's so important to find out, how is this drug working? Because there's this idea that I'm taking this drug and this drug is going to fix the problem, but they don't fix the problem, because the way that it is designed is to, does it give me the response or the reading that I'm looking for? It does? Okay, well, let's go ahead and hand it out. But then we're the ones that suffer, or whoever takes the medication will suffer, because they don't understand how it's going about doing that. And if we do, then we can then have a goal to address the root issue, even if we take it for a short period of time. And a short period of time is 6 months or less, ideally, without going into the extreme side effects. But if we think that this is the answer, then we'll just continue to take it, like so many of us do for years. And these symptoms are just accepted. And since the time passes, we assume it's age, and it's not age. It goes back to a nutrient deficiency. And so this drug is causing, one of the nutrient deficiencies that it's causing is, in the responses that are taking place, is because of a change in this. And this is an imbalance, and the system needs to be balanced. Our bodies are designed to regenerate and to heal and recover. And when something is not operating properly, we experience something that's not at its level or at a level that it used to be, then guess what? There is a nutrient deficiency that needs to be addressed to bring things back into balance, and some sort of a lifestyle activity that goes along with that, meaning what our body was designed to do anyway. And so mood changes is also another thing, which totally makes sense, because if we, for example, have neurotransmitters, these are using nutrients in order to perform the action. And so when it disrupts the calcium signaling in the brain, these are one of the responses we get. Don't know about you, but I don't need to invite depression or anxiety or irritability into my life. And it affects our life in so many ways. This is affecting our relationships. When your body's not well, how can you fully express love and appreciation for another person if your body is not in the condition that God said that it can be in, which is healed, which is functioning in the way it was designed? When our vehicles are not working, we take it in and we want it to be fixed. We don't want to keep going back and going back. We want it to be fixed. Okay? Now, we're a lot more intricate and detailed than a vehicle, but if we want a vehicle to be fixed, we should definitely want to function optimally as well. And the thing about it is that we're going to go over some things that will give you the option to put your body back into balance and have it working at a more optimal level. Okay. So amlodipine, it doesn't fix the root cause of high blood pressure. Instead, it creates nutrient imbalances and deficiencies, which make your health even worse over time. So if you want to move away from these side effects that you're experiencing, or I guess I should say these effects of the medication, then there are some options here. Okay, so remember, like I said, Nutrient deficiencies are at the root of the issues that we have within our body. They're the building blocks that we need. So when we drink certain things, when we eat and chew certain things, we put loads upon ourselves and toxins in our body. And we just say, well, it's within calories, so it doesn't matter. Or we say, well, the scale looks okay. No, we have things that are going on the inside. So you don't just want something to look good on the outside. You want to feel good as well. You want energy. You want strength. You want balance. You want coordination. You want your brain to work. You don't want Alzheimer's. Okay? And so the thing is that even when we look at things like high blood pressure, they're all connected to these other things. You'll probably know individuals that are on multiple medications. They're on cholesterol and they're on high blood pressure. They're on diabetes medication and they're on high blood pressure and cholesterol because they're all connected. And so what will happen is many of these healthy recommendations for one thing will also give you positive side effects in another area that you'll greatly appreciate. So let's talk about some of these things that you can do to start to support your body actually getting healthy, okay? Now, for one, if you're taking a medication right now, if you've been taking it consistently for any length of time, you want to communicate with your doctor, okay? Communicate with them. Let them know, you know what? I want to get myself healthy so I can come off this medication. Now, if your physician responds in a negative manner or they're not open to that, then you might want to find someone who's open to working with you. You want someone that's going to teach you, to show you, to ask the right questions, to work alongside with you, adjusting the dosages and things like that. So find someone who's willing to work with you. Of course, I recommend a functional medicine doctor because the goal of a traditional functional medicine doctor is to get to the root, is root-based solutions and not just addressing symptoms. And so the good thing about that type of physician, so find a functional medicine doctor and find someone you can work with in the capacity of doing this. And you can find out, well, who have you helped before to come off their medication? And that right there will help to, give you some information on whether or not you want to work with that person. Okay. But get someone to work alongside with you. Hopefully your physician is open to it. I know some clients, their doctors have told them, you're never going to come off with this. Then I have other clients whose doctor said, look, I'm going to give you this drug, but we can't stay on this. Okay. Now the thing is that we have to be our own advocates because traditional physicians, they're not trained unless they go and get additional schooling. They're not trained in nutrition. Okay. So as far as the nutrients that are at a deficit, you can go and ask them, but I can tell you 90% of the time, they're not going to have an answer for you. Or they might even tell you, no, there's no connection to nutrients because they're not taught that. They just don't know. They know how to address a symptom with a medication, okay, with a drug. That's what they're trained in the majority of the time. So you're going to need to be your own advocate and ask questions and then go find the answers as well and find someone who wants to work with you in regards to this or that does have this education in this area, because a traditional physician is not going to. That's just not how the system is set up for them to be trained. Okay. Now we're looking at support. We're thinking about these nutrients supporting the natural function of our body. Okay. So while you're going through that, find a physician, working with your physician, you can do these things nutritionally because it's what our body needs anyway. Well, some of the things that help to strengthen and the blood vessels, help them to regenerate and structure themselves in a manner in which will allow them to work for us is vitamin C. Okay. Now, when you find a vitamin C, make sure that the vitamin C, that it is a full spectrum vitamin C, okay? So it's not going to be ascorbic acid, which is the most common ones that you'll find in drugstores. Don't even go to a drugstore to get any sort of supplementation, but you want to get a full spectrum. And when you read the ingredient list or what's in that supplement, it'll have a list of different types of fruits and things to where it was extracted from, okay? There's one brand called Paradise. I believe it's Paradise. They have a good vitamin C. Then there's other ones as well, but some of them will even incorporate ascorbic acid with the other components of it, but you want a full spectrum vitamin C. Okay. Another one, matter of fact, Paleo Valley has a good vitamin C as well. Hey, the other one is vitamin K2. Another one is magnesium. The majority of the population is at a deficit of magnesium because of our poor food supply and our high toxic load here. So we need magnesium. There's different types. Just don't get oxide. Magnesium oxide is not a good form, okay? The other forms are pretty good. Now, omega-3s, very important as well. Omega-3, make sure you get a good quality omega-3 that doesn't have any of the seed oils like canola oil, vegetable oil, any of those things in it, okay? Next is CoQ10. These are things that are depleted typically, even if we're not taking a medication. So we definitely need it now. CoQ10. And another one that is going to help, these are some things that will actually help with the vasodilation. So one of the ones that really stands out to me that I'm really familiar with is the beetroot extract. So it's beetroot powder. And basically it forms natural, it's very potent in helping to get nitric oxide, okay? It's also helpful for a lot of other things, but nitric oxide, you might have saw products that use it as a natural energy supplement or whatever, but it's because of the nitric oxide. It helps to dilate the blood vessels and increase the blood flow. So that's another one that I've found to be really effective. Arginine is another one. It helps once again with nitric oxide production. I do want to say this, that as we increase with age, our natural nitric oxide production does decrease, especially because of the lifestyle that we have, okay? And a lot of other ones, we have L-citrulline, once again, the beetroot extract, hawthorn berry, and physenogel. So all of those help with to perform the same function as this drug that's there, okay? Now, amlodipine, once again, I want to remind you, it's not a cure, okay? And this is the issue that I oftentimes find with clients that have been taking it for a long time, is that it's this idea that the doctor gave me something to cure the situation, and they don't, okay? The pharmaceuticals don't. What they're doing is addressing the symptom, and sometimes it's needed because we have taken it to such an extreme. We've ignored the signs for so long, and it's necessary. But you want to understand, it's not for long-term use, okay? So while you're on it for those reasons, and sometimes we don't even need to go on it because our body can respond really quickly when we understand what it's all about. I just want to encourage you to seek something that's natural and to, make sure that you are supporting your body and what it needs. Research and study, find out what it is that the body needs so that then you can support it in that aspect, take care of the root cause, and then experience the benefits that I know you want to experience, okay? All right, you all. So good talking to you. Thank you for listening, and I look forward to sharing some more with you pretty soon in the near future. Have a blessed day.